Hello and welcome to the Womb-Centered Healing Podcast. I'm Sama Morningstar and I have Nandi with me here today. Nandi is a midwife in New Mexico, is that right?
Yes.
And I would love for you to introduce yourself and share a little bit more about your work and what womb-centered healing means to you.
Yes, thank you. Thank you for inviting me, having me here to speak.
My pleasure.
My journey. Well, I was born and raised in a family where my mom was a huge advocate for home birth and lactation and birthing naturally. And she was an assistant. She never made it and wanted to really wear the full hat of midwifery, but she was an assistant to a midwife in Illinois, and they were doing underground births in the 70s and 80s.
What does that mean, underground birth?
Well, in Illinois, midwifery isn't recognized as a profession unless you're a nurse midwife. So they were not seen, they did not carry a license to practice medicine, saying that with quotes, in the state of Illinois. So there was people who wanted to have home births and they wanted midwives there, and there still isn't a legal way to do that unless you're a nurse midwife or an OB. There was a couple OB practices in the Chicagoland area that was doing home births into the 90s. So I think the early 2000s still too, but I'm not sure if they're still around. But anyway, my mom and her were going to births and would sometimes have to ask for help. And one time they came in and didn't get heartbeat or didn't like the heartbeat and got to the hospital and there was no heartbeat. And that midwife got arrested and charged with the felony. And that that ended their underground career. And my mom started just being a Lamaze teacher and teaching people how to birth naturally, and was banned from hospitals because she would teach people and advocate for people. So when I came to my first pregnancy, I was 21, 96. I was in Illinois still, and I can't find a home birth midwife.
When you were pregnant, personally, with your first baby? Okay.
My first baby. So I kind of sped up from my childhood, grew up with my sister in my
very much of an activist mother.
Yes.
Right? Who's getting kicked out of hospitals because how she's teaching her birth preparation classes. They're like getting wind of, the doctors are getting wind of what, because then the patients are going to the doctor saying, well, so-and-so in the birth class said this and that. And the doctor's like, we got to get rid of her. Right?
Exactly.
And then, of course, you heard her on the phone, even if she wasn't talking to you directly. She was talking to her girlfriends, and you're listening into the dialogue, and you're asking questions, and she's having girlfriends over maybe, and they're all sitting around talking about all this. And wow.
I heard the story on my basement. The basement was like furnished and full, but there was my whole life I saw the weeks of gestation of how it grew. And that, my mom had a crocheted cervix.
Did she make it herself?
Yeah, it was knitted. She's
knitted. She knit a demonstration cervix.
And this was in my house. It was just things I played with.
Wow. Did she demonstrate with like a ball or a doll of the head?
Of how the baby's born,
and she would show with the knitted cervix it could stretch.
She had a knitted uterus cervix. Yes.
Wow. Awesome. Is your mom still around?
Yes. She's 70. She'll be so mad. 74. She'll be 74 this year, so in August.
I wonder if she'll talk to me, because I'm also doing a thing around stitching, sacred stitching. And so I'm talking to people about stitching their own menstrual pads and other womb health fabric sacred objects that are specifically for womb health, and that definitely qualifies. Knitting a demonstration cervix womb for childbirth preparation classes. That's awesome.
I wonder, I should ask her, I wonder, if she has any of that stuff left. And she had like the Atlas childbirth book. So I just saw all this stuff all my life and heard about it. I was not born at home, but my birth story is, my mom was like, oh, we're going to do this one natural. I was her second child, and we'll just set it up. We have a good doctor on our side. She gets there and she's in labor, but they want to do PIT. And she went along.
That's Pitocin, right? For those who don't know the midwifery lingo.
They augmented her labor. She was already in labor, sped it up, and I was born pretty fast after that. It wasn't needed. So,
well, thank goodness it didn't start a cascade of interventions.
No, it didn't. That was 74. And then 3 years later, she had my sister almost to the day, and at home. Mm-hmm. And that's a memory I have in my head. So my sister's born in 77. Years later, 96, I'm in my mother's house. I'm laboring. The plan is I'm going to go to the hospital. I have detailed plans of what they can and cannot do. My plan is to get there to push. Well, I don't really have a pushing stage, and my daughter started to come, and I remember sitting on the toilet thinking I had, a bowel movement coming, and it was her head. And my mom called the paramedics, and my partner was right next to me, and my whole family was there, and 8 men showed up in my room basically to tell me to push. They didn't catch her. She flew out onto my bed, and very pink and very happy and smacking her lips, giving me kisses. And she was put on me with an oxygen mask. She was very pink. And like I said, smacking her lips. She didn't need oxygen, but that was the procedure. And I said, I want to be a midwife. I was a chef, inspired at the time, had been to culinary school. And I said, this is not fair. Like, people are missing out on something here. And the only reason I don't have a midwife here is because it's not really legal in Illinois, and I can't find a midwife at the time to do this birth, and this isn't okay. And I was also living a lifestyle that is very natural. I was living the lifestyle of a Rasta woman, and that community mostly was going to the hospital, and that didn't make sense for our lifestyle to be doing that. So my calling became, I need to be a midwife for my community. And that's where the journey began.
Wow. And so did you first study midwifery in practice in Illinois, or how did you do that? Were you an underground midwife for a period of time?
A little bit, yes. I started classes. There was an underground Black midwife, and my friend got pregnant shortly after, and she taught us both classes. They both ended up in Jamaica at the same time. This is now the year 2000. I've been taking classes, learning things, and she goes down there because that's where her partner is, to have her first baby. And I traveled down there a few times during her pregnancy and gave her prenatal care. She's also going to a birth center and getting prenatal care. That was Sherry Daniels Birth Center in Jamaica for a while in Kingston. And I came for the birth. I spent a good 7 weeks there with her, and caught her baby in Kingston, Jamaica at that birth center. Yeah.
And so what's the status of midwifery in Jamaica?
Oh, it's legal there. I think Sherry's practice became very busy and big and was taking a lot of clients away from the OBs, and they got her out of there.
They got her out of there? What do you mean? They shut down her birth center?
They pretty much got her out of there. I don't know the whole story because this is being taped, but she is not in Jamaica anymore.
Wow.
And that's where my best friend gave birth.
Was she an American and she had gone and opened a birth center there?
Yes, Sharon American, I believe, and she had a lot of Canadian midwives working there helping her out because she wasn't even there when my friend gave birth. It was a Canadian midwife. I think her name was Kim, and she was wonderful, and I learned a lot. My friend was in labor for 3 days, asynclitic baby.
What does that mean?
The baby was coming in, we call cockeyed or jacked up in there, wasn't coming in anterior, was coming in right transverse with the head crooked.
Okay, so let's translate this language for listeners who haven't studied all of this. I know it's hard to do, but I'm going to give it my best shot because I know, I'm reviewing my doula training here. Mm-hmm. So anterior means that the baby's face is facing the sacrum, is facing the back of the woman's body, right?
Right.
And that's the ideal position.
Yes.
Because the baby's head can be extended this way, and with the shape of the woman's pelvis having the face facing instead of the big hard part of the head, puts less pressure on the sacrum, and the front of the pelvis can open up more to allow the big part of the head to come out. Is that right?
Right. And he was actually, wait a minute, he was actually anterior. He was not anterior. He was posterior asynclitic. So even harder. So that means his right side of his back was bone back on back.
So his face was facing up towards the front of the mother's body. His back, his spine was going against her spine, which is hard on mom.
Yes.
And hard on baby because he doesn't have that soft place to go with the spine. Whereas when they're facing the other way, they have the mom's belly is nice and soft for that spine to bend and move and do what it needs to do. And the back of the head has more space to move through. So he's facing up. It's also called sunny side up, right?
Up to the right.
And a little to the right, and maybe with a kinked neck like this.
And he stayed like that for a long time. And coming in on the right side is not as preferable as coming in on the left.
Why is that?
I don't know the full answer to that. It is easier to come into the world coming in on the left than the right.
Well, energetically, our left side is our feminine side. So perhaps in a woman's body, the left side of the woman's body has more room.
Yeah. There's less organs on that side.
Okay, there we go.
Why? There is a reason why, I'm sure scientifically, but it's not coming to me right now. But he was coming into the world hard.
Yeah.
It took a good 3 days to get him, 3 days, and with me holding her cervix open. This is my first actually my first labor was my sister's, but this is my actual labor. I'm in it. I'm not just being a doula. I'm taking on some midwifery roles. The first time I wore sterile gloves and had to keep them sterile and as much as as possible, and holding my best friend's cervix open. Why they pushed on her fundus, which is I will probably never see in a birth here in America. She probably would have gotten a C-section here in America, but he got out as they pushed on her.
They pushed on her fundus, which is another word. It's the word for the pregnant woman's belly.
Right.
Now, I thought it was the word for the belly after the baby was out, but it's also the belly while the baby is still in is called the fundus.
Yeah, well, it's the top of the uterus. It's the ledge of the uterus. Okay. That's what we're measuring from the pelvic bone to the top of the fundus. That's what we're measuring in centimeters. That usually correlates with the gestational date of the baby, right? So if you're 35 centimeters, a lot of times you're 35 weeks. So they were pushing on the top of the fundus to get him out. He came out with a sore on his head. It was
because it was rubbing for that long on the bones.
Yeah,
And so
there.
And now why wouldn't this happen in the US, the pushing on the fundus?
Because it's dangerous.
What can happen?
It can cause a uterine rupture. It's not good to do. It's putting a lot of pressure, and it takes skills to do that. In 7 years of being a licensed midwife, I don't think I have the skill or want to do that. If we can't get a baby out at home easy enough, we need to go in for help.
Okay. And so you were working with other midwives that had more skill than you, who were able to successfully, they'd been in these situations before, perhaps where there wasn't the access to going into a hospital. And these are what women have done, this kind of thing. Midwives have done this kind of thing all over the world where there's not, these hospitals to run to.
Yeah. Having a C-section is expensive. It's not the go-to run to in Jamaica. It doesn't seem like they have a huge C-section rate, and they're doing them a ton of times. Like, it would have to be a good reason, and they felt like they had the skills enough to get him out, and they did.
Wow.
His heart rate never dropped, even though he was sitting there crazy for a couple days.
Well, isn't there ways, and because I've learned a little bit of this, aren't there ways of massaging the baby in the mom's belly in order to help the baby reposition?
Yeah, what I know now, and what I've learned from stuff like spinning babies, we probably would have done something to try and get him to move for sure. And this was my early on doula midwifery days.
Right.
What I know now and then is different. Yeah.
Yeah, I mean,
you've done something else.
Right. I mean, as a body worker, sometimes if something's kinked, you don't just keep pushing it in that direction. You want to back it up, let it straighten out, and then it can go. I mean, that would be my instinct, would be to, like, let's let his neck lengthen out again and get it, So anyway, all right. So wow. So that was your initiation into midwifery, and you still were like, I'm all for it. I'm doing this.
All for it. I was totally about it. And at that time, I was living in Illinois, out in Oak Park, which is the first western suburb of Chicagoland, of Chicago. And I was in a state where I didn't want to go to nurse midwifery school at that time to learn midwifery. I didn't want to be what I thought was tainted by the medical system. I was very young and impressionable, and I just had this way of living, and I decided I need to move somewhere to learn midwifery. So it was either Jamaica, because I had made connections there, and my lifestyle I was living, it just all seemed like, hey, let's move to Jamaica. Let's make this work. Found like places to live, was looking for work for my partner. And then we also had friends here in Albuquerque, New Mexico, was saying, oh, New Mexico is like the best state to give birth in, and midwives are abundant here. And so we looked at both places, and we traveled, and we decided it was easier to stay in the States and move to New Mexico. And that's, I came here 19 years ago in June 1st, I arrived.
Wow. Okay. So that same year, year 2000, was when you were experiencing your friend's birth in Jamaica, and then you said, all right, that's it. We're going to New Mexico, all around your passion
for midwifery.
For midwifery.
Yeah. And it just felt like my calling and my liberty, and let's do it. And my partner at the time, he was fine with it, and we had our first child, and the three of us packed up and left Illinois and came down here, and the journey began.
And so you went to, or you shared with me earlier that you trained as an apprentice to another midwife, and they have training set up in New Mexico, but I think also in California, that you can do that kind of an apprentice or apprenticeship type of learning scenario instead of going to an actual campus or a school or something like that.
Right. A little different in California is that you have to be in a MEC accredited education, or they still, I think, have the California challenge if you don't go through that MEC accredited
Right.
education, where you sit for this challenge test after you take the NARM exam, which is another national accredited exam that midwives take. That's what I took. That's what the state of New Mexico uses.
Right.
For me to be a licensed midwife. So in New Mexico, I'm an LM and a CPM, which is I'm a licensed midwife and a certified professional midwife.
Okay.
My apprenticeship, I did not go to a MEC accredited school. I could have. I do not have a degree in this. I don't need a degree to do this work, even though probably that will change in the future. I am looking to get a degree as a CPM along with looking and doing nurse prerequisites right now, nursing school prerequisites.
Okay.
Yeah.
So I just want to weave together the womb-centered healing and the midwifery model of care for people who aren't as familiar. I probably tend to get in a little bit of doula speak with you, even though I'm trying to keep it for those who don't have that. But so for me, and I'd love to hear your perspective too, womb-centered healing, why am I interviewing midwives and doulas is because midwives and doulas offer a standard of care to women who are birthing babies, which is one of the big womb experiences for women in our lives, and offer a standard of care that that diminishes the likelihood of birth type trauma or additional wounding than what we might already carry in our wombs. And so that's why I'm always including doulas and midwives, because there's a standard of care of empowering women to make their own choices and decisions about how they want to birth their babies as much as possible, to make their own plan, to inform women about their choices and the options and all of the possibilities, and educate women. Because a lot of birth trauma comes from women not knowing what their options are and just being sort of corralled down a procedural, convenience type of approach to birth that is often what's seen in hospitals with doctors that, have a schedule and want to get that baby out by 5 p.m. on Friday so they can have a weekend, and so there's a lot of interventions that are unnecessary, as you outlined in what you described your experiences to be, out of convenience, out of procedure, that aren't based on the evidence-based care that shows what actually does facilitate the most healthy birth process for women and babies. And so midwives and doulas are at the forefront of educating us, re-educating women and families about that, and empowering us to, if we do need to go to the hospital, not doing a home birth, to be able to communicate and interface with that system and assert our own rights to make our own sovereign choices about our birth process and about how our bodies are treated in that circumstance. And so I'd love to hear your if any stories or experiences are coming up about the healing quality of your work. Oftentimes women have a traumatic birth experience for their first birth and then say, you know what, I'm going to have a midwife for my next birth because I feel it'll be better. So you may have had experiences like that where your quality of care that you're able to offer as a midwife attending home births is very healing then for your clients.
Yeah.
And so I'd love to hear about that.
Yeah. When I think of one centered, what are you're calling it, womb-centered
Womb-centered healing. Mm-hmm.
healing. I think of exactly that, centering the person who's carrying the womb in practice, in healing as an individual. I do think of midwifery as a way to heal the womb, to make it the center of, if you're coming into my office, of your pregnancy. Sometimes things are going on emotionally that are affecting your womb and your healing and your health, if I should say. So I'm always focusing on, the well-being, the whole well-being of the person walking into the door, through the door, to get care from me, and it's prescribed to that person. Not everybody needs the same thing. I think that's what the midwifery model does so well, is that I mean, when they say it's the art of midwifery, I really take that to the art of, I'm painting a picture for this person in this amount of time of care. They're almost with me for a whole year. And in that year, how am I going to help them on their journey? Sometimes birth is traumatic, even at home, but because they're being, hopefully in my care, I feel like this is true, being respected, being heard, being informed all along the way, that they have the power to make decisions for themselves. I'm there to empower them to I guess spark that light of power. I'm not even empowering them, they're empowering themselves.
Mm-hmm.
And that I'm just there to guide and protect, to hold space, to make sure everything is normal. That's what womb-centered healing is. That's what's coming to mind right now.
Mm-hmm. Beautiful.
Yeah.
Yeah, thank you.
Mm-hmm.
And, you shared about while you're with them for a year, some women usually, when they're pregnant,
Mm-hmm.
very soon after, they're looking
Yeah.
for their care providers. Very soon after they find out they're pregnant. So then that's, at least 8 months you're with them while they're pregnant, then during the birth, and then several months afterwards to make sure everything is okay. So, and sometimes longer. And so that whole pregnancy process, you're educating them, you're helping them be in the best health that they can possibly be on all levels, emotionally, spiritually, and that's beautiful. And so I warned you before, I'm really passionate right now about ancestral healing, and particularly the use of herbs in our healing process, and the interface between the way that herbs help us physically and the way that herbs help us emotionally and spiritually, and the memory of the way that herbs and aromas can access our cellular memory of not only things that have happened in our own past that need that healing too, but in our generational past. And so I'm curious about your experiences working with clients who may have healing from back in the generations that has been necessary in order to facilitate the best possible birth outcomes.
Mm-hmm. Mm-hmm. So if you don't know me, or if you haven't seen me before, I identify as a Black woman, a Black mother, a Black midwife. There isn't many of us. The history in this country has taken away a lot of my ancestral knowledge. Colonization has made it really hard for me to know exactly what was going on with healing, ancestral herbs, and what was being done in the postpartum time, what foods were being served. I'm still kind of I'm definitely learning a lot about that still now, and plan on taking an herbal class on about herbs that were used by my ancestors. So in a lot of ways, I'm purposely saying this because I'm still learning. Mm-hmm. Some things that I have done even just recently, and I've learned this through midwifery, we tend to suture a lot after a baby comes through your canal and your perineum, and sometimes that gets torn. And I worked with a midwife who was really against suturing. she was just, it was not her thing. And then I worked with, I did not just have one preceptor, I had like 5. So I worked with a lot of different midwives who did a lot of different things to heal, because the thought is it's trauma on trauma. This baby come out, you might have tore, there might be some things that need to be sewed up, but do we really need to suture it? And not every tear needs to be sutured. So some things that help heal it, a lot of people don't know, is like frankincense, just little drops of frankincense, honey, seaweed. Recently I did seaweed and frankincense on somebody who birthed with a partner and I a year ago and was back in our care again and had a pretty bad tear the first birth. And the second one, we made all these plans so she wouldn't tear. She did tear again, pretty much the same place, but not fully like last time. She had pretty much gone all the way to her rectum. This time she didn't go all the way that far to a 3rd degree tear, but it was borderline, almost 2nd degree. So I did some different things and she was on board with it and it worked. And
wow, so when you use the seaweed, are you actually using a piece of seaweed, or are you using powdered seaweed mixed with the honey? No, you're just...
we just used the seaweed. We like laced it on top of each other where the wound was open and checked it in a few days and it was closed. It was pretty
so amazing. Just a couple of days and it closes the wound.
Yeah.
And so is this just on the outer surface of the vaginal opening, or does it go all the way in a ways?
In this case, it was, yes, we put it on the inside and right on the perineum where it tore. And so it was outside and a little bit inside.
And so
strip on the outside, strips ladled in the inside where there was 2 tears on both the left and the right side.
And so how does the seaweed then stay in and on the body? I mean, I'm assuming that the woman is she's going to the bathroom, she has wastes to eliminate. Do you have special instructions for her to make sure that she doesn't remove the seaweed? It kind of sticks, I'm imagining it's sticking.
To remove it, this is what we just tried, and her husband kept helping putting it back on.
Oh.
He was all about helping.
Oh yeah.
Nicely, and that we didn't suture this time because suturing was really hard on her. So she had to lay down a lot and she had to keep her legs together. That was another instruction that I had for her, that she wasn't to lift anything, do any squatting, that she just kept her legs together. And if she was okay with that, then
you could try it. And the wound closed. And did you continue the treatment after the wound had closed up? Did you keep
it a little bit with frankincense, sitz baths? That's another thing we did, a lot of sitz baths, Epsom salt baths. This all brings the tissue back together, and little drops of frankincense in the bathtub and 1 drop on the pad. And frankincense is very astringent, so that's why I'm saying 1 drop.
It's pretty intense too. I know directly on the skin, especially that mucous membrane, there can be quite an intense sensation.
Yeah, and that's why we did it in the bath. And on the pad too, you can dilute it with a cotton ball, with water and 1 drop. And I'm really saying 1 drop. You guys, have had people do more than 1 drop. It is not fun. It can burn. Yeah, but it just helps. It brings the tissues back together. And so in that case, that was using, I think, more ancestral healing.
The seaweed was a new one for me. I hadn't heard of that, but I can imagine that would be more prevalent on an island like Jamaica, for example.
Yeah. Right.
Is that where your ancestry is from, in Jamaica?
No. My ancestry comes from Africa.
Okay. But there's lots of coastline in Africa, so
yes,
you may have had
seaweed anywhere.
So I'm assuming that you would soak the seaweed first so that it was moist and pliable to put it on a woman's.
We've just laid it on her. And it was something I read in a book, I think written by Anne Fry in her suturing book. Yeah. And I was like, start trying different things than always bringing out the needle. There is times it is beneficial to definitely suture and know how to do that skill, and also heal that naturally. Same kind of things would have happened in frankincense, honey, sitz baths. Yeah.
Wow. And so I imagine that was very healing for her to have such loving care and alternatives presented and offered and implemented so successfully to the trauma upon trauma of tearing and then having to be sutured, poked with the needle and string pulling through. I mean, wow. So amazing. So that's one way. And, I've also, and maybe you've seen this in books, and I don't know if it's used as an alternative to suturing, but I imagine it would be very helpful in that situation as well, and for ongoing healing of tears, and also just sort of the contusion, the compression or sores that might happen from, say, that baby's head that was in the same spot. Yeah, the baby's head had a sore. I imagine there was some sore spots inside the mom from that head being in that one spot for a while. And that is comfrey.
Comfrey, yes.
It's very, it's used, and so do you use and offer comfrey to your moms?
Typically? You know what, I really haven't, since I worked with that midwife that I'm talking about that isn't a fan of suturing and doesn't really suture that much. She used comfrey a lot, and she grew it in her backyard when she lived here in New Mexico, and she would also go collect it off of people's lands, because comfrey grows wild all over the place here.
Nice.
But I haven't. You're reminding me. I need to get that in my bag again. So. All
right. Well, because comfrey is really good for weaving our tissues back together when they've been wounded, and in an organized way. So it's not just getting back together, but are they getting back together in a disorganized, knotted up scar tissue kind of way? Or are they getting back together in a smooth, aligned, easy to flow way?
It's the same thing with the seaweed, I noticed, and the honey and the frankincense and the sitz baths that this client did. Everything came back very smoothly together. There was no bumps. It didn't even look like she tore. We were amazed, like wow, doesn't even.
And had you noticed that you could tell that she had torn before from the sutures? Like you could notice there was scar tissue. Yeah. Wow.
Back like a puzzle. Like
the pieces, it hadn't lined up properly because it's the doctor in there deciding where it's going to line up.
Yeah, well, that in case was my partner. She was a midwife, and she did the suturing. I wasn't at her first birth, and at her second. I don't have a partner anymore, but we used to work together, and she's a seamstress. She's really good at suturing. That's her thing. She can do it really well.
But even the highest skilled suturing seamstress can't know exactly what part of the tissue is supposed to line up with the other part. It's the body's own wisdom that you're then evoking with that seaweed and inviting to find its own way back together. Beautiful. That is so gorgeous. Oh my gosh, I'm having
ways to heal. And yes, and being in your own practice, and if your clients are on board to try it and trust you, it can happen.
Beautiful. Well, thank you so much for sharing all of this wonderful womb-centered healing wisdom from your rich midwifery practice. I'd love for you to share if you have a way that folks can get in touch with you if they're interested in talking with you more about your work.
People can reach me at Nandi Midwife at yahoo.com. They can reach me on Facebook, Nandi Andrea M. Hill. I think it says Wadata Midwifery on there too. Or you can call me at 505-974-8431.
Wow. Okay. Wonderful. There you have it, folks. Lovely Nandi Midwife in New Mexico. Albuquerque, right?
Yes, I'm in the center of the state. Albuquerque.
Okay. And how far do you travel for your midwifery services?
2 hours. I'll go to Gallup, New Mexico, which is 2 hours west. But 2 hours is my limit.
Okay. Good to know. And thank you so much once again for joining us here. And thank you, listeners, for joining us and reveling in this womb-centered healing midwifery discussion. I hope you enjoyed it as much as I have. And if you want to learn more about the Womb-Centered Healing Temple, you can go to wombcenteredhealing.com, sign up for the newsletter. You might be interested, if you were interested in our little herbal discussion at the end here, and you've been listening to the latest podcast, you'll know that I'm preparing to share a ancestral healing with herbs course coming up soon. So if that intrigued you about this conversation, I recommend getting on that newsletter mailing list to learn more. Again, that's at wombcenteredhealing.com. All right, thank you so much for joining us, and that's all for now. Until next time.